Hi, this is Dr. Evan Osar, author of Corrective Exercise Solutions to Common Hip and Shoulder Dysfunction. We get a lot of questions about the squat pattern. How deep should I squat? What should it look like? Is it okay to actually create some posterior pelvic tilt through your squat pattern? Because again, the argument is, yeah, it eccentrically loads the erectors. Okay, I can't argue that fact. It does eccentrically load the erectors when you go into a posterior tilt. But here's the thing. You have to be sure, or have you checked to make sure your client is stable in a lumbar spine flex position? Can they go into lumbar spine flexion and not shut down? If you're not doing muscle testing, if you're not checking range of motion before and after your pattern, then you do not know. You're just assuming that they're stable. And we see in our clinic over and over again, most of our clients are lumbar spine flexion intolerant, meaning they cannot tolerate flex spine position, and they can't tolerate it, especially if it's loaded up. So let me show you what I mean by flex spine intolerant, or flex spine position. So again, Steven do a squat like most people teach a squat pattern. So again, he looks real good, real good, and now he goes into spinal flexion because he goes into a posterior tilt. Now come on back up. Good, and one more time. So again, stays nice and controlled through his upper spine, and then he starts getting posterior tilt, lumbar spine flexion, come back up. So the debate comes in that, well, babies are in posterior tilt when they flex their spines. Well, when they sit into a deep squat, well, actually they're not. If a child has good hip centration, knee centration, ankle centration, spine centration, they are actually neutral all the way down. They have the range of motion in their pelvis, they have the range of motion in their hips, they have the range of motion in their ankles. They can get down and be neutral. We want neutral all the way down. Again, if we allow the client to go into a posterior pelvic tilt, we are opening up the SI joints, which destabilizes the SI joints, and we're creating lumbar spine flexion, which overloads the discs and the ligaments and soft tissue of the low back. So again, if you want to flex them by going into a deep squat, you better be sure that they're stable in that position. Okay? So let me show you what it looks like. How deep should we squat a client? We're going to squat them as deep as they have hip mobility and ankle mobility, as deep as they can go while maintaining neutral postures. Okay? Joint centration essentially is what we're talking about. Okay? So again, he's going to activate, stay long. He's going to come down into his squat position. I'm going to stop him right before he runs out of range of motion, which is right about there. Now come back out. Make sure he stays active all the way through. Get nice and long, tall, and he stays centrated in his pelvis and his hips as he comes up. He does not drive forward, so go ahead, drive forward. He does not go into that drive forward position that decentrates the hips and puts his low back at risk. So again, stays long, activates, stays controlled, comes down into squat position, stays nice and neutral, perfect. Come back up, and perfect. That's Steven's range of motion. You squat them as deep as they can remain controlled. You can load them up. You can load them up with a dumbbell, kettlebell, front squat, as long as they can maintain that alignment that we just saw on the client. As soon as they start hyperextending, they start disconnecting through their thoracolumbar junction and disconnecting their abdominal wall, then you know the weight's too heavy and/or that pattern is going to compromise your client. So again, check for the markers of spinal stability, hip mobility, and staying neutral throughout the pattern, and your client will be able to squat regularly and with control and without harming their hips, spine, or other regions of the kinetic chain. Dr. Evan Osar with Fitness Education Seminars. Hope you enjoyed this. Have a great day.